Well, earlier today, police fired rubber bullets at the crowd. Meanwhile, the health minister, as we mentioned, visiting the hospital earlier this morning. Our reporter, Pule Letshwiti-Jones, following that story for us. Let's bring you the latest now from what is happening outside the hospital. Pule joining us outside the Accident and Emergency Department, and seeing visuals earlier, Pule, of not quite scuffles, but very, very angry members of both Dudula and the EFF, essentially squaring off.
Well, you know, these are very different views from what we witnessed yesterday. Yesterday it was quite physical and intense. We did see the scuffles that were taking place between both members of Operation Dudula and, of course, members of the EFF. Today we saw that, that those tensions that are brewing between both groups being calmed and stopped by police officials, members of the SAPS there. This after members of the EFF, of course, had, forcefully removed members of Operation Dudula outside the Kalafong entrance here where patients actually go in. Members of the EFF have maintained that both documented and undocumented foreign nationals should be given the privilege of having the access to medical facilities here in the country. And now what we understand is that Joe Phaahla has actually come here to say that the next step now would be, of course, to urgently speak to governments of the neighboring countries regarding the influx of some of the foreign nationals coming in and having access to some of the, state public facilities in the country. Joe Phaahla, of course, has condemned what has happened outside, but most importantly as well, saying this is an urgent matter that has to be looked into. But joining me now, we continue to get reaction from unions as well. Earlier on, you played a clip from the Hawu, who are actually of the view that their workers should be protected and not intimidated when coming to work. We speak to Denosa this afternoon, the Tshwane Regional Secretary, Mr. Sileke. Thank you very much for joining us on eNCA. Now, let's just start with the reaction from you in terms of what the Minister of Health had said. One of which aspects is very important, says that there seems to not be a record of the number of foreign nationals coming into these health facilities here and accessing medical care. Is that something you may be concerned about?
Thank you very much, Pule. There's nothing to be excited about from what the minister said, and this minister is just being reactionary. This particular problem has been existing for a very long time, and they are now becoming as if it's a new thing that has been raised to their face. They have known this particular problem from the time of Aaron Motsoaledi. They have known that Jerusalem Kisa was there. This particular challenge was on his table. On the issue of what we are saying of records, we think the minister is being untruthful, because there are records. We have there's no nursing. The integral part of nursing is recording. So nurses, our nurses record each and every patient that comes in here. They'll know whether the patient is Malawian, they'll know whether the patient is Zimbabwean, or the patient is from other foreign nationals. So the minister has not been truthful, and we are not excited by what he just said now.
Minister Joe Phaahla speaks about now having to speak to governments of the neighboring countries. They believe this could be a much more better approachive way of regulating what is currently happening, what is currently forcing both groups such as Operation Dudula and EFF to embark on pickets, but most importantly also saying the government in South Africa is not being lenient towards the approach they're taking to this matter. What's your take on that?
The government is lenient because it's not doing anything about this particular challenge. Like I said, it has been there, that particular challenge. But what the minister is coming and promising you things that are as if that the problem is new. It is not new, and we are not excited about what he just said.
So do you think speaking to governments may work of the neighboring countries?
If that particular narrative would work, why has he done it for a very long time? It has been there, and that why is it treated as if it's a new thing? We could have done that particular thing. That's a simple approach that should have been taken very long time ago. But for the mere fact that he's saying it now as if it's a new thing, I don't think it will even work. Let them strengthen the borders if there's a need to do that.
All right, let's speak about the health workers. Nahawu says they're quite concerned about the safety of the health workers at the hospital. As Denosa, do you share a similar view that with these pickets happening outside here, which seemingly becoming violent as well, your workers will be intimidated if they have to come work here, and subsequent to that, patients are affected?
Yeah, we share the sentiment with our sister union Nahawu, and we are really saying that hospital should be a place of tranquility, place of peace. If at Operation Dudula and EFF have difference, let them sort out somewhere else, but not in the hospitals. Yes, we did receive the complaint for our dark-skinned nurses that they are intimidated as well when they have to enter the premises. So that is unacceptable, and we're saying that if there are differences, let them sort out anywhere else, but not in the place of peace where as a hospital should be.
At this particular particular moment, I also know that some of those doctors who were coming from other neighboring countries, of course, coming here to render services as medical health practitioners. Are you also representing them? Do you believe that they should also be protected?
They should also be protected. We are not in a banana republic in South Africa. There are laws. There's a constitution that protects them. So we don't agree with what is happening currently now. But we are saying it's a discussion that must be held, but somewhere else, not in the hospitals, where people and patients must come and be treated. We have our oath that we have taken as nurses, and it must be reflected as much as doctors, as well as doctors. They have their oath that they have taken. So we are saying whatever particular narrative or discussion, it must not happen here because it's affecting the health service. And the sad part of that is that it's affecting this hospital that is already limping from its management, the management of the CEO. The CEO here is corrupt. We have alleged that corruption, and we have sent that particular document to the DDG. The CEO here has police managers. So the hospital in itself is already limping. There are senior aid managers who have just left the hospital, this particular hospital.
Which is quite, a contrast to what you're saying, because the minister here is happy with the CEO's work, saying that they commend the records that the hospital has produced in terms of the work they're rendering to the public. I'm sure this is something you guys are against.
We are very angry. Actually, the minister must withdraw that particular weight. You can't just come here and from just viewing, of just looking at things and say the CEO is doing the great work, even the hospital is running well. He does not know. He's not working here. We are here on the ground every day, and the minister should resist from such talks. The minister here is brutalizing people. 8 managers. I'll just make an example of the nursing manager here. He put the nursing manager into precautionary transfer to another hospital. After that, he hires a new nursing manager. What kind of madness is that? But that's what he's doing, the CEO of this particular hospital. He does not know the challenges that are happening there, and he says he speaks from a luxury of his ministerial position that the hospital is very nice. He's not here. He must ask people who are here, and we asked to engage with him. He refused. The minister said he will engage us through proper departments, and we have written, like we have said, we have written that to the DDG, and we are still waiting for his intervention.
Just the last one before we go. Of course, this is happening outside Dudula and EFF. Are you concerned that these similar acts may spiral out of control to go to other neighboring hospitals as well, and as a result, threatening the functionality of the health system in this country?
We are really concerned. But we hope that the minister will not only sleep in Parliament, but they would come, even the Minister of Police, into the ground and address this particular issue. We are happy that the minister did not leave after addressing the media, because that's what they do. But we are happy that at least he's engaging with these particular people. We are hoping that the engagement will bring forth results after engaging, and this particular situation will be contained.
That's Mr. Seleke, Regional Secretary of DENOSA in Tshwane, speaking to us, Gareth, just giving us a bit of reaction regarding that matter there. Quite harsh about their words, not mincing their words as well, saying that they hope the health minister can actually act, as this is an urgent matter which may spiral out of control if they turn a blind eye to this. But also particularly important, they're saying the safety of medical healthcare workers is something that should be prioritized, and it's something as unions they may be discussing and wanting to find a way forward as to how other groups such as Operation Dudula and of course a party EFF can resolve their issues outside the perimeters of healthcare facilities in this country.
Pule Letshwiti-Jones on that story for us outside Kalafong for the moment. So lots of clarity still needed from the health minister as well. Unions unhappy. They want more engagement on how this is going to be working. Expect a full report from Pule Letshwiti-Jones again a little bit later here on eNCA.